Our core exercise is likely to help low back pain. Use this test, the Posterior Instability Test, also known as the Facet Shear Stability Test. There are two positions. Position 1, the muscles are relaxed, belly on the table, legs off. Position 2, the patient will contract the muscles by holding onto the table and lifting the legs. The doctor adds a shearing force to the facets in both positions. Good. Okay, the Posterior Instability Test is also known as the PIT test. It is also known as the Facet Shear Stability Test. If you want to read about it, Dr. Souza talks about it in his lumbar spine chapter. I also have an article about it that I wrote. It's in your lab note, in your lecture notes, and the printed notes, and you should read it. This is the best way to predict if a core program will help somebody with low back pain. Low back exercises or core exercises will help with low back pain. So the patient's presenting today with low back pain, somewhere in the lumbar, maybe sacroiliac region. You ask the patient to lie down on a table in an awkward position, so you have to be very clear about it. Put out some face paper, and you say to the patient the following. Okay, today what we're going to do is see if core exercises really will help you. That's a good idea, right? It's a weird position. The top of your body is going to be on the table with your face here, and the bottom of your body is going to be hanging off the table. Okay? So go ahead and lay down with your face right here. Your hips are on the table, face down. Yeah. Perfect. Your hands are going to be super relaxed. They're going to be right next to your face, and you can turn your head sideways if you want. So the idea is that his pelvis is stable. He's very relaxed. You can feel his muscles are soft. I'm going to have me push on him in all the parts of the lumbar spine. I need to press hard enough, but not to hurt him. I want to see what hurts. Tell me if any of these things hurt or feel weird. You can see I'm going pretty deep, you guys. Any pain? You hanging in there? All of it's just wonderful? That might have been something there. Okay, let's say right here at L3, he had pain. I would then say, how bad is it on a scale of 1 to 10? Let's say he says a 5. That's position 1. The doctor pushes the facets and shears them. That's why it's called a shear test. The second position is he has to hold on with his arms to the table. That's to engage the upper core. Then he lifts his legs off the floor. Go ahead and lift them, both of them together, up on the floor. Make your legs be straight. There you go. And he doesn't have to bring it straight up. They just need to go off the floor. Go ahead and put your legs down. Can I show your spine to the camera? So look at his muscles. Now lift the legs up. Did you see how the muscles engaged? So now, go ahead, keep the legs up. Position 2, shear the facets again. And this time, he should feel a lot stronger. Even if he didn't have pain. You didn't have pain, right? Did it feel better when you lifted the legs up? Did you feel it was like tighter and stronger? Good. And that's normal. If he had pain, a lot of times people say, the pain's gone. Relax. Now, if a person hurts when they lift the leg, then you probably have a muscle strain. Does that make sense? So what we're checking to see is if the muscles turn on, does it protect the facets? And it does. So if a person has pain in position 1 and relief in position 2 when they engage the muscles, and you can look at them and say, I'm excited, I think this core program is going to work with you. And we'll do the adjustments, but we're going to give you some exercise, and I think you're going to feel a lot of relief. Okay? Thank you.